DNP-BC magazine presents Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
We are all in search of the elusive fountain of youth. Our guest today may not know where to find it, but she certainly has some tips of the trade to share with us to keep us looking young and beautiful. Good afternoon. Thank you so much for joining us, and welcome to Black Health, a platform to discuss health in the Black community. I am your host, Dr. Michelle Kirwan Blythewood. I am a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. And today we are discussing all things beauty with nurse practitioner and serial entrepreneur, Dr. Natasha Weems. Dr. Weems, welcome to Black Health.
Hi, how are you? Thank you for having me today.
Absolutely. It's a pleasure to have you. And I'm personally looking forward to hearing how I can maintain my youth as long as possible. I used to say I was just going to age gracefully and not worry about it. And now I feel like I'm saying I'm not going down without a fight. So I'm excited to hear what you have to tell us today.
Likewise.
Thank you. Let me take a moment to introduce you. Dr. Natasha Weems is a qualified nurse practitioner, serial entrepreneur, beauty and wellness enthusiast, and a devoted mother. Her active role and educational background within both business and beauty knows no bounds. This aids tremendously in her launch of Care First Wellness Med Spa. Highly educated, Dr. Natasha Weems holds a bachelor's degree in communication from Wayne State University. She then completed her Bachelor of Science in Nursing program at Oakland University. Natasha's latest mission is to help you reach your beauty goals and invest in your health. Again, Dr. Weems, welcome to the show. So tell us how you got into nursing. What led you into the field of nursing?
You know, pretty much I had a lot of experience behind the scene with nursing. I had family members, my aunts were nurses. So to be exposed to that at such a young age and see how impactful a nurse can be to a loved one or family members, or just being able to resolve problems with health and provide management. And it was just very important that I also perpetuate that and encourage other women to pursue the nursing profession.
I have a special place in my heart for nurses. My mother is a nurse as well. So what field of nursing are you in, and tell us what you enjoy most about it?
So I actually have a background in primary care. I've also currently do acute care nurse practitioner management and services. And I have launched a med spa business in Marietta, California. And I just really love this new, aesthetic area of practice, because it's just so innovative with some of the procedures that they have and some of the solutions that they have now to just preserve some of that youthfulness, and just to have those options to resolve some of that fat and problem areas. I just think it's so refreshing, and I'm just really happy to help someone tackle areas like alopecia and obesity. And these are just issues that really plague a lot of women and a lot of people, especially with different types of issues with health and diet and food. So this is really important to me. I have a history of alopecia as well. So just to know that I can help offer a solution to so many women, it's really refreshing. And I just really feel really excited about this opportunity.
How do you encourage young Black women to go into nursing?
I really feel like you have to identify what it is that you want to pursue. If you feel like this is something that's for you, I feel like people should have an opportunity to go into that environment to make sure that that situation is conducive to what you want to, your journey and what you want to pursue in life. But I would encourage you to always continue your path and go with determination, full force, if that's something you want to do. But you have to have compassion when you're in the nursing field. Compassion is very key. Obviously, you have to be competent, but compassion is just really a fundamental goal that you should have.
Congratulations on the upcoming launch of Care First Wellness Med Spa. What types of services are you going to be offering?
Again, there's going to be hair loss, rejuvenation for alopecia. There's going to be weight loss management to help with obesity, to improve some of those areas of hypertension, diabetes management. And there's going to be different areas like Kybella that's going to help with some of those areas for segmental fat increase and stubborn fat areas that are just pocketed and you cannot address with exercise, diet. And many women feel like they have those problem areas that they can't tackle 100% with exercise after giving childbirth. So we all have like experienced that in some way with women who have had those concerns. So to have non-invasive options is really, really nice to have and be able to offer that.
What's going to be unique about your med spa?
Just being able to provide a diversity and being able to, you know, interact and provide services and be able to really improve the communication and the diversity and just being able to, service all different walks of life. So that's important when you're dealing with people who are interested in aesthetics and being able to provide services for all types of people.
So I saw on your brochure that some of the things that you'll be doing would be chemical peels, lip blushing, and microneedling. Tell us a little bit about those three options, what
I
they
know
do, what they're for.
a lot of people have questions about the lip blushing, and lip blushing actually is more so if you think about like a permanent tattooing,
Mhm.
you can change the pigmentation of your lips. So some people have a history of smoking, or some people just naturally had a change in their lip color. So they want to have a more youthful look in their appeal to their lips. So you can also have a color change and just have more a vibrant appearance in your lip. Microneedling and chemical peels, if people have different skin issues with acne, there's so many different options that you can go in that regard. And also there's PRP with the hair loss rejuvenation. We withdraw the blood and then we put it in a centrifuge and use that rich plasma and inject it into the scalp to help rejuvenate some of those follicles for the hair loss rejuvenation component. So there are so many things that we offer that can
Mhm.
help address issues that people are battling with. So I do get a lot of questions about the lipo-dissolve as well, because a lot of people are wanting to target those, hard to approach areas when they're dealing with the weight loss.
Okay. Um, a lot of people, when they think of maintaining a youthful appearance, we're talking Botox and fillers. Are there less invasive options than those, or some that might have same or similar results? Some people are afraid of needles. They want to, keep the frown lines away, and they want to keep the laugh lines away, but they're afraid of needles, and they don't want to, or they don't want to be injecting something into their face. That throws some people off. So are there other options? I think microneedling might help with that a little bit from
That
what my
is
understanding is, but I might be wrong.
that is less invasive, and yes, you are right. That is something that you could decide to go in that direction if you are not one that would like neurotoxins, which are things that can relax the frown lines and the muscles. So you can go with microneedling, and you can decide to pick a certain type of chemical peel or dermabrasion. So there are different types of solutions for problem areas outside of having to have anything that's invasive or anything that's involved with needles. PDO threads are also something that they're needles, but they're very tiny needles. And that's something that people tend to like as well, because you get a long lasting outcome from that, because it steadily produces the collagen and helps with that over time. So people tend to see a more smooth appearance and tightness in their skin. So that's another option if you don't like the idea of neurotoxins or Botox or fillers. So
And
that's
what was that
something.
last one? You said it's PDL?
Oh, it's PDO. It's a
PDO.
new, yeah, it's a new procedure that people, they're tiny, they're very tiny, and they call them threads as well. And so you can inject them in small areas and you can do larger areas as well. But it just depends. Everyone has different preferences. So it's really important to discuss the different options and do a consultation and also make
Mhm.
sure the person that you're also seeking services from that they have training, they can show you that they have training and experience.
Yes, because I've definitely seen some outcomes that don't quite look what I think was originally intended.
And it's important to do follow-up and to adhere to instructions as well. But yeah,
Mhm.
I completely think that consultation is very important so you can discuss the outcomes. And a lot of people have to understand you have to be eligible for, procedures. A lot of these procedures, a lot of chronic conditions will make you ineligible, especially if you have chronic conditions or bleeding disorders or anything like that. And we just try to make sure you don't have any history of like transplants or any issues with the liver and the kidney, depending based on the procedure that you pick. So we just want to make sure we have realistic outcomes. And with all the procedures, we try to embrace your natural beauty. So, yeah, just you still gonna look identifiable.
Okay, that's good. So, one of the things that I have to combat on a fairly regular basis as a pediatrician is Dr. Google and Dr. TikTok and Dr. Facebook and the things that my patients learn on these, social media outlets. And they come to me and they just insist that, so and so died on TikTok because they received whatever vaccine. So, do you see the same thing in the beauty industry? Are there fads that you see maybe on TikTok or Instagram or what have you that you think might actually not be good for one's youthful appearance?
I think we're always going to see trends, especially in social media. And I just always try to advise people to be very cautious as to what you decide to do and what provider you decide to go to. You have to go to someone that's compassionate and that really is going to really take in your safety and not just give in to what procedure you want because it's a trend or a fad. You really need to be eligible for these treatments and anything in excess. I know people don't want to deny anyone or turn them away, but health is primary. Health is
Mhm.
very important. So if you are not eligible for procedures or if you're trying to be excessive with a procedure, I think anything can have a poor outcome if it's excessive.
Yeah, that is definitely the case. And I have seen some folks that have gotten different injections and um, lifts in various areas of their body and then have developed significant
Migration.
autoimmune issues. So it can be very serious. So tell us about the latest and greatest treatments available, or what is your favorite treatment for maintaining youth?
Yeah, so I tend to know that a lot of the patients that I inject, they really like the idea of the Kybella and they really are excited about the lipodissolve. So they really feel like it's a opportunity to target certain areas of the body. It's nothing excessive. Actually, over time, you gradually see the targeted area slim down. So it's not anything that's very abrupt, but people really like the outcome. They really feel like, regardless of the exercise and the diet, and by all means, I always encourage people to diet and exercise regardless. It's
Mhm.
always important to have a healthy lifestyle. So, aesthetics is one thing, but primarily, you're always going to want to include your diet and exercise. But yeah.
Mhm. So, what does prevention look like to you? Is that diet, exercise, anything else in terms of preventing the need for some of these treatments?
You know what I really enjoy is intermittent fasting. Have you tried that?
I have, not quite deliberately. It's more like I have a ton of patients in the room, and I just can't get to, and that happens quite often. So I'm quite often intermittent fasting, but not exactly on purpose. But I don't worry too much about it since I know that it is good for you.
So yeah, I think that intermittent fasting, always being aware of what you're consuming and just trying to stay active at least 30 minutes a day. Try to be active and moving around, hydrating, using sunscreen. There's so many ways that we can have more healthier outcomes and try to prevent, diabetes and hypertension and obesity. So I think that when you're trying to intentionally improve your diet, intentionally improve your food selections, that is important. I also take, ketone supplements through Prove It, and I just really enjoy the way it makes me feel and have more energy when I am doing intermittent fasting and exercising. I don't feel sluggish. So those things have really improved my health and the way I feel. Years ago, like when I had my toddler, I almost died. I went into
Mm,
preeclampsia,
mhm,
and just to have a blood pressure of 200 over 100, it was really devastating and not knowing what your outcome would be. So that
mhm,
really made me intentionally exercise, encourage people in my community to be healthier. And I would even post some exercise workout videos just to encourage others. Women feel, or people just feel like their schedules are so busy
mhm.
with work and kids and projects. Like we have a ton of things going on in life, but you have to take time out for self care. That's
Mhm.
very important, regardless of what's on your agenda. So that's something that I try to encourage. I try to promote. I post videos, and that's something that we provide as well in the clinic. If people want a personalized diet meal planning, that's an opportunity, to discuss that and provide that as a service.
Yeah, to piggyback on what you're saying, I always tell my parents of my patients that it's very important to one, just be organized and to try to plan. So meal planning and prepping maybe over the weekend if you're not working and just getting everything ready for the week, even dishing it out into Pyrex dishes for Monday, Tuesday, Wednesday, etc. And exercise, I often recommend just trying to get up in the morning. And even if it's getting up 30 minutes earlier and just spending even 15 or 20 minutes of that time doing a quick exercise, there's so many things online that you can find that are 15, 20 minute, and you can actually accomplish a lot. And if you're doing 15 to 20 minutes, 3, 4, 5 times a week, it will, it eventually adds up.
I
And then you
agree.
just feel better and you feel
You
more positive,
do.
like you got it done. And I think it really helps motivate to continue to do it. And next thing you find yourself doing a bit more and a bit more. So I
I
I,
agree.
I love that prevention advice that you're giving. What recommendations do you give for women that are in their 20s and 30s that might differ for women in their 50s and 60s?
I think that I pretty much tell people, like, if you're in your early 20s, you can definitely handle your health a little more aggressively to prevent poor outcomes. So just making sure that you're staying hydrated and that you're avoiding any chemicals and drinking and illegal drugs, things that are just going to be harsh to the body. So I feel like in your 20s, just trying to stay away from tobacco use, all of those
Mhm.
things will really show later on in life. So that's very important to be aware of. Dental, a lot of people are not
Mhm.
focusing on following up with dental, and that can cause
Mhm.
issues with your health overall. And people, I don't think they correlate dental with
Mhm.
cardiovascular disease and things like that. So I definitely highlight that in the younger population. Just watch, be mindful of what you're doing, because when you are 40 or 50 and you start to have cardiovascular disease, hospitalizations because of some of the poor decisions you made early on, you definitely could prevent a lot of those issues.
You mentioned hair loss rejuvenation. Let's talk a little bit more about that. One of the treatments you mentioned was PRP, taking a patient's blood and then injecting it into the scalp. Are there other, and alopecia is such a humongous problem for Black women. And, this is our crown, and according to many Black women, and it's very important to us to maintain our hair. And I'm seeing more and more Black women losing their hair. I think that the hair products, I guess, so to speak, that we've used over the years, weaves and things like that, have added to it. But there's a lot of just autoimmune alopecia and other types of alopecia that have nothing to do with braiding in hair and things like that. That's a whole nother show that I am going to tackle, and that I really do want to, because I think the warning signs for alopecia are there, and a lot of women don't know them. And that you can, if you figure it out early, if you realize it earlier, there's a lot more that can be done to prevent it. So that's a coming topic. But let's hear what you do, so that those who may be experiencing alopecia, what else is there besides PRP? Is it just the PRP that you're doing, or do you have other things you're doing?
You can also have a component of microneedling as well for the hair loss, and there's also topical agents as well. But I'm glad that you mentioned that, because I personally experienced going to the dermatologist and being told that your alopecia, your hair loss, your area of thinning is due to braids or is due to tension. And so I decided to investigate that. And the outcome was, it was genetic.
Yeah.
It was an influx of hormones after childbirth. And I
Mhm.
never knew that, because over the years I was being told African American women tend to have a lot more tension on their scalp due to braids and different hairstyles. And so that's why you have alopecia. And that was not the case.
Yeah,
So
that's definitely
many
always
people
the
can
case.
have an androgenic alopecia
Mhm.
and not know and not have that community of support. And it's very heavy on your mind to not know what it stems from, or what are some options to help with the hair loss management. So I'm glad that you did mention that, because that's something that I feel like we struggle with, because a lot of
Mhm.
providers tend to not understand our background and how to address our hair loss.
Mhm. And there's so much that can be done for hair loss, but really identifying what the problem is, because if you don't identify it early, sometimes you get to a point where you cannot treat it. Like with scarring alopecia, once the scalp scars, that hair won't come back.
Right.
That area has scarred. So identifying it is key, and then having obviously the treatments, the knowledge about the treatments is great and is key as well. And you also mentioned lipodissolve. Who is that most beneficial for? And can you tell us what lipodissolve looks like? What a person expect when they get to your office and they've signed up to get lipodissolve treatments? What happens?
Yeah, so I think people are really excited about lipodissolve. It really is designed for people who want to target certain areas of hard to address areas without exercising and dieting. So those stubborn areas of fat, those are the people who are candidates for, lipodissolve. It's not weight loss. It's for
Okay.
targeted areas. And so we do a consultation. We actually look at the areas that want to be targeted, and then we figure out pretty much a plan of care. So some people could pick their abdomen, some people want a bra fat, and those are the most popular areas that people want to target. Kybella is more so for the chin area. So those are other areas that people tend to feel like, even regardless of weight loss, generalized weight loss, sometimes there's just stubborn areas that are just hard to address. So those are some options that we offer, and those are some popular services that people are wanting.
So and how do you pronounce that? Kybella or
Oh,
Kybella?
Kybella.
Kybella. I have never heard of Kybella. So that's doing the same thing in this area, like
Yes,
involving the fat in that area. Okay.
yes, yeah.
So
So the oh.
go ahead.
Mhm, mhm.
Go ahead.
Oh, so the Kybella is going to be more so for facial, and then the PCDC, the lipodissolve, is going to be more so for larger areas to target.
Are there any side effects to be concerned about with either of those?
Definitely. Any type of injections, you have to be careful, make sure that there's no infection. Also, there's going to be some swelling, and many
Mhm.
people report that they have some tenderness in the area, maybe a week, some shorter. Some people say it only lasts about a day, but some people feel like it feels like they've exercised in that area, or they've been doing some
Mhm.
sit-ups or crunches. So it's normally short-lived. Most of the people that I've injected said that those concerns were just a couple of days. I've never had any really severe outcomes from this procedure. Many minimal, so redness at the injection site, but pretty much resolves within a day.
Okay. And how are the long-term results? Is this forever, or do you need to do treatments every now and then?
So based on the consultation, we decide how many treatments. Some people need more than one session. Some people actually like the outcome of just having one session. So some people want 2, 3, 4, depending on the area that we're targeting. They'll need more than one session. So these are going to permanently kill the fat. So so over time, you'll see some people still say they see the results even after 6 months. So it's important to still have a healthy diet. It's important to still exercise, but many people really like the outcome and enjoy that they're able to actually finally target that area.
Wow, the field of beauty has really advanced. There's so many new things out there that I can't keep up with all of it.
It's
You
exciting.
it is very exciting, and it's nice to have options.
Right.
So you also do IV. You will be doing IV hydration. Is that correct?
Yeah, a lot of people really like the idea of IV hydration, especially during the COVID-19 when it was really hitting hard and just recovering from that. So a lot of people felt like rejuvenated. There's a lot of different injections that people like to add, vitamin B12 injections. So people feel very energetic after their IV hydration. And there's so many different ones that, you can choose from. There's a whole menu. Some target rejuvenation, some target primarily dehydration. So, yeah, so people are really starting to really get excited about IV hydration as well. I know that many people really felt like it helped catapult their improvement in the way they feel after recovering from the COVID-19 as well. So,
Okay. Yeah,
that
we
helps
just
with
had,
jet lag and
yeah.
nausea and all of that, yeah.
My mom, she's in her 80s, and she recently was quite ill with GI illness and
Okay.
refusing to go to the hospital. So we finally called in an IV nurse, and that helped tremendously, to keep up her hydration until she finally relented to going to the hospital.
Oh,
So you are also starting a new luxury fitness clothing line. Is that correct?
yes, Winter V. I actually named that after my toddler because of the
Okay.
situation, yeah, that I had with the preeclampsia and just
Mhm.
really, yeah, when you have those life altering events, right? You just really
Mhm.
sometimes you can use it to make you feel overwhelmed, or
Mhm.
sometimes you can use those situations to really help you focus on a different direction. And so that helped me realize that it's my goal to influence other women to really handle your health, really find time for self care. We oftentimes prioritize other things, our tasks, our roles as being mothers. And so it's really important to actually exercise, and I promote self care. So this clothing line is an effort to make you feel good and encouraged about actually getting in that gym, or even working out at home, yoga, Pilates, whatever it is that you find that is successful, I definitely encourage it.
Okay. Well, Dr. Weems, you're a very busy woman, very successful woman. It is wonderful to see all the wonderful things that you're doing. How does somebody get a hold of you if they're interested in your med spa? I know it is in California, I think you said, right?
Yeah, so there's a lot of social media. There's IG at Dr. Natasha underscore. There's a website, drnatashathenp.com. If you want to visit that, there's a link for booking as well, and a phone number to the clinic. So there's a lot of ways. If you want to get in touch with me, just send us a email and we will respond.
Well, we wish you all the best, Dr. Weems. Thank you so much for joining us today. It was a pleasure having you. I've learned a lot on this episode, and we look forward to having you back, maybe in a little bit of time once your med spa has launched, and check in and see how you're doing. Before we close, I would like to say a word of thank you to our sponsors. Black Health is brought to you by FAMU Medical Marijuana Education and Research Institute, get credible information, and engage in a safe space to learn and talk about cannabis. Educate, learn, and talk about cannabis in Florida. And don't forget MIA Magazine's other shows. We have weekly podcasts. Mondays, The Business of Black Business at 1 p.m. with Jay Reynolds. Tuesday, My Money, Your Money at 7 p.m. with Bridget Lumpkins. Wednesday, Soul with Nikki Gellin, who sings that far better than I do. Thursdays, Lunch with Legacy Leaders at 12 noon with Anne-Marie Sorrell. And Taste of South Florida at 7 p.m. with Chef Irie. Closing out the week is Black Health, hosted by me, Dr. Michelle Kirwan-Bythewood, Fridays at 2 p.m. Dr. Weems, one more time, thank you so very much for your time. We appreciate your time and your expertise. And everybody who is out there watching, we welcome you back to our next episode of Black Health. Thank you for joining us today. Take care, everybody.
Thank you.